Hi everyone, I am Dr. Treesa P Varghese, working as Associate Professor and Head, Department of Pharmacy Practice, Yenepoya Pharmacy College and Research Center, Mangalore. Today's session, we are going to discuss about pneumonia. These are the table of content. In this lecture, we will be discussing about introduction and definition of pneumonia, anatomical classification of pneumonia, what are all the different types of pneumonia, etiology and risk factors of pneumonia, what are the different signs and symptoms associated with a patient who diagnosed with pneumonia, what are the diagnosis pattern of pneumonia, treatment of pneumonia, then complications of pneumonia, and finally how do we prevent and control pneumonia cases. These are the specific learning outcome. At the end of this lecture, students should know to define and classify different types of pneumonia, recognize the signs and symptoms of pneumonia. Students should know how to diagnose pneumonia, including various clinical assessment, imaging techniques and laboratory tests. Students should able to categorize the patients according to Curve 65 criteria. In this criteria, according to this criteria, you can categorize the patients into IP or OP, that is inpatients and outpatients. Then next one, to understand the principles of pneumonia management, including antibiotic therapy and supportive care. And finally, as a student, you should know how to prevent and control pneumonia cases. Coming to the introduction, what is pneumonia? Pneumonia, it is an inflammation of lung parenchyma. This inflammation occurs due to the infection of alveoli in the lungs. What do you mean by alveoli? Alveoli are microscopic sacs in the lungs that absorb oxygen. Here in this picture, you can see the alveoli. What do you mean by alveoli? Alveoli are tiny microscopic sacs in the lungs that can absorb oxygen. So, in pneumonia causes inflammation or infection in the alveoli. So, as a result, this alveoli are filled with a fluid or pus, making it difficult to breathe. So, as a result of this pneumonia, the patient may get breathing difficulty or dyspnea. So, before moving to the anatomical classification of pneumonia, we should know about the anatomy of lungs. So, as we all know, we have two lungs, that is right lung and left lung. Right lung contains superior lobe, middle lobe and inferior lobe, whereas left lung which containing superior as well as inferior lobe. So, the superior lobe, middle lobe, inferior lobe is divided into these three lobes by oblique and horizontal fissures. So, here in this case of right lung, you can see two fissures, that is oblique and horizontal fissures, whereas in case of left lung, you can see only one fissure, that is oblique fissures, which helps to divide this left lung into superior and inferior lobe. Now, coming to the anatomical classification of pneumonia, there are mainly three types of pneumonia according to anatomy, that is mainly bronchopneumonia, lobar pneumonia and interstitial pneumonia. Now, we are going to discuss each one in detail. What do you mean by bronchopneumonia? From the name you can understand bronchopneumonia, that is this infection or inflammation which is mainly affect around the bronchi, that is called as bronchopneumonia. Then coming to lobar pneumonia, it is an infection that involves mainly in a single lobe or a section of a lung, that is called as lobar pneumonia. Then next one, what do you mean by interstitial pneumonia? In this interstitial pneumonia, infection involves in the area between the alveoli. So, what do you mean by interstitial space? The area between the alveoli, that is called as interstitial space. So, interstitial pneumonia is nothing but the infection or inflammation that involves in the area between the alveoli, that is called as interstitial pneumonia. In this figure, you can easily understand or you can easily differentiate the difference between bronchopneumonia, lobar pneumonia and interstitial pneumonia. The first one is bronchopneumonia. Bronchopneumonia is nothing but the infection or inflammation which occurs in the bronchi. Then next one is lobar pneumonia. Lobar pneumonia is nothing but the infection or inflammation or pneumonia that occurs in the lobar part. That is, we have already seen right lung has a 3 lobe and left lung has a 2 lobe. So according to that you can see or you can differentiate the pneumonia. Then third one is interstitial pneumonia. Interstitial pneumonia is nothing but the pneumonia or infection or inflammation occurs in the interstitial space between the alveoli. That is all about the anatomical classification of pneumonia. Now we are going to discuss about different types of pneumonia. As we have already seen anatomical classification, it is mainly divided into 3 types, that is bronchopneumonia, then interstitial pneumonia and lobar pneumonia. Now comes to the types of pneumonia. First one is viral pneumonia. What do you mean by viral pneumonia? As the name indicates, that is, this is an infection or inflammation of lungs that is caused by viruses. Mainly influenza A and influenza B viruses are most commonly causes this viral pneumonia in adult. Other than this influenza A and influenza B viruses, coronavirus, rhinovirus, parainfluenza virus and adenovirus that can also causes viral pneumonia. So in viral pneumonia, this is mainly a respiratory droplet infection. What do you mean by respiratory droplet infection? That is, this is a fluid from someone's sneeze or cough can transmit viral pneumonia. Then comes to the mode of transmission. As we have already seen, this is a respiratory droplet infection. This is also transmitted through contaminated surface. So what do you mean by respiratory droplet infection? So respiratory droplet infection is nothing but if respiratory droplet which containing this virus which will be spread into the air if someone cough or sneeze. So that can causes inhalation of this viruses by an uninfected person, that can causes the spread of disease. That is called as respiratory droplet infection. Through contaminated surface also this respiratory infection can spread. Then now comes to the signs and symptoms of viral pneumonia. As we all know, there will be fever, then cough will be there, then shortness of breath or dyspnea can be seen in patients. Then in some patients there will be possibility of pain in the chest when they are breathing. Then next one, treatment. What is the treatment modality? As we all know, what is the causative organism of viral pneumonia? The viral pneumonia causative organism is virus. So antiviral medication can be given as a treatment. Along with the antiviral medication, you can give the symptomatic treatment also. Then next one is bacterial pneumonia. What do you mean by bacterial pneumonia? This type of pneumonia, it is caused by bacteria. So these are the examples of bacteria that can causes bacterial pneumonia, that is Streptococcus pneumonia, Staphylococcus aureus, Haemophilus influenza, Streptococcus pyogenes and Klebsiella pneumonia. These are the different types of bacteria that can causes bacterial pneumonia. Among all these bacteria, Streptococcus pneumonia is the most common bacteria that can causes pneumonia in adult. After that, Haemophilus influenza, this is the second most common cause of bacterial pneumonia. So this bacterium, what happens is this bacterium may live in upper respiratory tract. So if you are not treating your upper respiratory tract infection properly, that can leads to lower respiratory tract infection. Ultimately, it results in pneumonia. So bacterial pneumonia often occurs in people over the age of 65 as well as in patients who are diagnosed with asthma or some other heart diseases. Much like a viral pneumonia, it has symptoms including fever with chills. So this fever with chills, this is the most common signs and symptom that is associated with the bacterial pneumonia. Other than this fever with chills, the patient can see this green or yellow color mucus. Then we have already seen what is bacterial pneumonia, what is the causative organism. So how would be the treatment? That is, antibiotics are most frequently used to treat this bacterial pneumonia. So this is all about bacterial pneumonia. So far we have discussed about viral pneumonia and bacterial pneumonia, and third one is atypical pneumonia. What do you mean by atypical pneumonia? Atypical pneumonia that is caused by organism that is called as atypical organism. What do you mean by atypical organism? Atypical organisms are nothing but they are difficult to culture. That means they do not respond to our normal culture. We may require a special media or special culture technique to detect them. These types of organisms are called as atypical organism. So these are the examples of atypical organism, that is Mycoplasma pneumonia, Chlamydophila pneumonia, Legionella species. So these all are the most commonly identified atypical organism. Now we are going to discuss about walking pneumonia. This atypical pneumonia, it is also called as walking pneumonia. Why it is called as walking pneumonia? This is a less severe type of pneumonia. That is why it is called as walking pneumonia, because this is less severe in nature, so that the patient can do their day-to-day activities. That is why it is called as walking pneumonia. This type of pneumonia has the signs and symptoms such as sore throat, headache and tiredness. Antibiotic can be used for the treatment. So this is all about walking pneumonia. So far we have discussed about bacterial pneumonia, viral pneumonia and atypical pneumonia. This atypical pneumonia, it is also called as walking pneumonia. Now we are going to discuss about community acquired pneumonia or CAP. What do you mean by community acquired pneumonia? It is defined as the pneumonia that is acquired outside the hospital. That is, from community we may get this pneumonia. These type of pneumonias are called as community acquired pneumonia. This community acquired pneumonia most commonly occurs due to the presence of this virus. Most commonly identified bacteria that can causes community acquired pneumonia is Streptococcus pneumoniae. Atypical bacteria are also can causes community acquired pneumonia. We have already seen what is atypical bacteria. What do you mean by atypical bacteria? Why it is called as atypical bacteria? These type of bacteria are very difficult to culture. They may not respond to our normal culture. That is why these bacteria are called as atypical bacteria. So you have to remember viruses, bacteria and atypical organism that can causes community acquired pneumonia. What do you mean by community acquired pneumonia? This is a pneumonia or infection or inflammation that is acquired outside the hospital. That means it is occurs from the community. That is called as community acquired pneumonia. Now we are going to discuss about hospital acquired pneumonia. What do you mean by hospital acquired pneumonia? These type of pneumonia that is occurs 48 hours or more after hospital admission and it is not present at the time of admission. These type of pneumonia is called as hospital acquired pneumonia. That means when the time of admission the patient may not feel any pneumonia or patient may not feel any signs and symptoms of pneumonia. After 48 hours of admission of hospital, patient may develop pneumonia. This type of pneumonia is called as hospital acquired pneumonia. This hospital acquired pneumonia that is caused by mainly resistant bacteria such as Pseudomonas, E. coli, Klebsiella, MRSA and VRSA. Then next one is ventilator associated pneumonia. What do you mean by ventilator associated pneumonia? From the name you can understand these type of pneumonia which will be developed more than 48 hours after a patient has been intubated and received mechanical ventilation. So after incubation, after 48 hours of incubation or mechanical ventilation, patient may develop pneumonia. That type of pneumonia it is called as ventilated associated pneumonia. Then what would be the reason for the occurrence of ventilated associated pneumonia? The most common type of ventilated associated pneumonia is microaspiration of bacteria that colonize the oropharynx and upper respiratory airways in seriously ill patient that can causes ventilated associated pneumonia. Next one, how do we diagnose this type of pneumonia? Ventilated associated pneumonia, it is diagnosed through clinical and radiological assessment. Now coming to the treatment. Treatment does typically involves appropriate antibiotic and supportive care. What do you mean by supportive care? Supportive care in the sense we have to treat the symptom, that is, suppose if a patient is having fever, we have to give some acetaminophen or paracetamol. If suppose patient is having some cough, means you can give some cough suppressant. This is what is called as symptomatic treatment. So along with the symptomatic treatment, antibiotic therapy and supportive care which will help to treat the diseases. Then next one is aspiration pneumonia. What do you mean by aspiration pneumonia? It is a lung infection that develops after aspiration of food, liquid or vomit into the lungs that leads to the inflammation and infection. What do you mean by aspiration? Aspiration is nothing but inhalation. So here aspiration pneumonia, it is occurs due to the inhalation of food, liquid or vomit into the lungs that can lead to the diseases. That is called as aspiration pneumonia. Aspiration pneumonia also occurs in individuals those who are having some swallowing difficulty or dysphagia and impaired consciousness. These type of patient, there are chances of developing aspiration pneumonia. Then what would be the signs and symptoms of aspiration pneumonia? Most common symptoms of aspiration pneumonia, which include cough, fever, shortness of breath, chest pain and increased respiratory rate. Then how do we diagnose this type of pneumonia? Diagnosis involve clinical evaluation and imaging studies like a chest x-rays can be done. Then coming to the treatment typically includes antibiotics to target the underlying infection and supportive care to improve respiratory infection. This is all about aspiration pneumonia. So far we have seen different types of pneumonia, that is viral pneumonia, bacterial pneumonia, community acquired pneumonia, hospital acquired pneumonia, atypical pneumonia, ventilator associated pneumonia, aspiration pneumonia. Now we are going to discuss about the etiology. What all are the reasons behind the incidence of this pneumonia? So here it is mainly divided into two, infection to the lungs and non-infectious reasons. What are the infectious reasons? That is, we have seen different types of pneumonia. In that we have already discussed what is viral pneumonia, what is bacterial pneumonia, what is atypical pneumonia. So infection to the lung that can causes due to bacteria, viruses, mycoplasma, fungal agents and protozoa. Then coming to non-infectious causes, inhalation of toxic chemicals that can lead to pneumonia. Apart from the smoke, dust and gases that can also causes pneumonia. Then coming to the risk factors, advanced age is one of the risk factors for pneumonia. The people, those who are older age, they have a more chance of getting pneumonia. Then history of smoking, that is also one of the risk factor of pneumonia. Then upper respiratory tract infection. If you have upper respiratory tract infection, if you are not treating them properly, that can lead to lower respiratory tract infection that ultimately results in pneumonia. Then apart from that, malnutrition, dehydration also can lead to pneumonia. Then recent respiratory tract infection, for example, common cold, laryngitis. Common cold, laryngitis, all these things comes under upper respiratory tract infection. As I have already informed, like upper respiratory tract infection, if you are not treating properly, that can lead to lower respiratory tract infection that ultimately results in pneumonia. Then apart from all these things, chronic lung diseases such as COPD, cystic fibrosis also can lead to pneumonia. Exposure to air pollution also can cause pneumonia. Weakened immune system or if you have some problem with immune system, that can also lead to the development of infection and inflammation that can lead to pneumonia. The patient, those who are taking some immunosuppressive therapy, that type of patient also have a chance of developing pneumonia. So this is all about the risk factors of pneumonia. Now we are going to discuss about the signs and symptoms of pneumonia. So all these are the signs and symptoms of pneumonia. That is, there will be high fever, shortness of breath or dyspnea will be there, there will be increased breathing rate, then chest pain will be there, dusty or purplish skin color, that is, or you can tell it as cyanosis, that is from poorly oxygenated blood. Then there will be fatigue and muscle aches. Then coughs will be there. There are two types of cough, that is productive and non-productive cough. In pneumonia cases, what we usually see is productive cough. That means there will be production of cough. Then non-productive cough, it is also called as dry cough. In non-productive cough, there won't be any sputum secretion. So that is the difference between productive and non-productive cough. There are two types of cough, that is productive and non-productive cough. This non-productive cough, it is also called as dry cough. So in non-productive cough, there won't be any secretion of sputum or mucus, whereas in case of productive cough, you can see the secretion of sputum or mucus. Then coming to the diagnosis of pneumonia, the first one is physical examination. Through stethoscope, you can detect the abnormal sounds such as cracking or wheezing sound you can detect. Apart from all these things, you can check the respiratory rate and oxygen saturation. So stethoscope can detect the abnormal sounds such as cracking and wheezing. Then other physical signs like increased respiratory rate and low oxygen saturation also can be assessed through this physical examination. Then next one is chest x-ray. A chest x-ray, that is a common diagnostic tool for pneumonia, which helps to visualize the lungs, which helps to diagnose the pneumonia, help to categorize different types of pneumonia. For example, in anatomy or anatomical classification, we have seen different types of pneumonia, especially lobar pneumonia, which can be diagnosed through this chest x-ray method. Then apart from all these two, we can determine the extent of severity of diseases. Location of infection also can be detected through chest x-ray method. Next method is blood test. In blood test, mainly two tests we are performing. That is, first one is CBC analysis. That is nothing but complete blood count analysis. And next one is blood cultures. So this blood cultures and CBC analysis may be conducted to confirm an infection and assess the severity of infection and identify causative agent. Through blood culturing, we can identify the causative agent. Then through CBC analysis, we can confirm an infection. We can assess the severity of infection. So this is all about blood test. In blood test, you have to remember mainly two tests we are performing, that is CBC analysis and blood culturing techniques. Then next one is sputum culture and gram staining method. In sputum is taken after a deep cough and analyzed to identify the causative organism. So you can take the sample before starting antibiotic. This helps to determine most effective treatment. So sputum culturing, which helps to detect the causative organism. According to that, we can give the treatment. Then next one is pulse oximetry. This measures the oxygen level in the blood. Pneumonia can prevent lungs from moving enough oxygen into the bloodstream. In pneumonia patient, there will be less oxygen saturation. So pulse oximetry, this is a method which helps to measure oxygen level in the blood. Then next one is serum procalcitonin level, which helps to differentiate between bacterial and non-bacterial causes. So this concentration of PCT or serum procalcitonin level, that is directly proportional to the severity of infection. That means higher PCT level, that indicate higher bacterial or greater bacterial infection, or severity of infection will be higher. So this concentration of PCT, that is directly proportional to the severity of infection. If you have a less PCT level, means less severity of infection. Then next one is CT scan. In some cases, computed tomography or CT scan also may be recommended to provide more detailed images of lungs, especially if the diagnosis is unclear or complications are suspected. In such cases, you can go for CT scan also. Then last one is bronchoscopy. This is an example of invasive method. This involved inserting a thin tube through a nose or mouth of a patient into the lungs, which helps to collect sample for testing. So here in this method, you can see in the picture here, this is an invasive method. This involved inserting a thin tube through a nose or mouth into the lungs to collect the samples for testing. So this is all about the diagnostic method. Now we are going to discuss about curve 65 criteria. What do you mean by curve 65 criteria? In this criteria, mainly 5 parameters are there. That is, first one is C. C stands for confusion, U stands for blood urea nitrogen, R stands for respiratory rate, and B stands for blood pressure of the patient. And one more parameter is there, that is 65. 65 that considered as the age of the patient. If the patient age is 65 or more than that, we will be giving 1 score to the patient. So here total curve 65 score, that is ranges from 0 to 5. So if the score is high means greater the chance of severity. Then a score of 0 to 1 may indicate suitable for home treatment. The patient can be treated as OP patient, while a score of 2 or higher than that suggests that there will be need of hospital admission, with a higher score indicate a higher risk of mortality. So this is all about curve 65 criteria. Then this healthcare professionals use curve 65 score to guide the decision about whether the patient can be treated as OP or IP. Then this is all about curve 65 criteria. As we have already seen, C stands for confusion. Is the patient is confused or disoriented? How do we know the patient is confused or disoriented? You can ask some questions to the patient. If the patient is not responding properly, you can assume the patient is in confusion state. So that type of patient you can give a score of 1. Then second one, U, that is stands for blood urea nitrogen. If the patient blood urea nitrogen level is greater than 19 mg per deciliter, you can give a score of 1. Then third one is respiratory rate. You can check the patient respiratory rate. If the patient respiratory rate is 30 beats per minute or more than that, you can give a score of 1. Then fourth one is blood pressure. Here mainly we are considering systolic blood pressure of the patient. If the systolic blood pressure is less than 90 mm per Hg, you can give a score of 1. Then the last parameter is age of the patient. If the age of the patient is 65 years or more than that, you can give a score of 1. So this is all about curve 65 criteria. So you have to remember here mainly we are focusing on 5 parameters. That is, first one is confusion. U stands for urea, that is mainly blood urea nitrogen, and R stands for respiratory rate, B stands for the blood pressure of the patient. Then 65, that is stands for the age of the patient. If the age of the patient is 65 or more than that, you can give a score of 1. According to the total score, you can give the treatment to the patient. You can consider the patient can be treated as a inpatient or OP. IP means inpatient, OP means outpatient. Now coming to the treatment, as we have already seen different types and risk factors of pneumonia, according to that we can give the treatment. For example, viral pneumonia, you can give some antiviral medication, that is oseltamivir and zanamivir. Then next one is bacterial pneumonia. For bacterial pneumonia, you can give some antibiotics. Then these are some antibiotics which can be used for bacterial pneumonia. First one, classification, that is penicillin drugs. Examples of penicillins are amoxicillin clavulinate, ampicillin, benzyl penicillin, piperacillin tazobactam, ticagrelin clavulinate. These are the most common antibacterials which are giving in a patient, those who are diagnosed with a bacterial pneumonia. Then next one, second class of drug, that is macrolide antibiotics. Example of macrolide antibiotic, that is azithromycin, clarithromycin and erythromycin. Then fluoroquinolone antibiotics, example ciprofloxacin, levofloxacin. All these antibiotics which comes under fluoroquinolone antibiotics. Here mainly we are focusing on 3 category of drug, that is penicillin category, macrolide antibiotics, fluoroquinolone antibiotics. Now we are going to discuss about vaccination method. Apart from antibiotic antiviral therapy, mainly 2 types of vaccinations are available. That is, first one is pneumococcal conjugate vaccine. Next one is pneumococcal polysaccharide vaccine. So what do you mean by pneumococcal conjugate vaccine? So from the name indicate, that is short form is PCV 13. PCV13 which prevent against 13 kinds of bacteria that can causes serious infection in children and adults. So that is all about pneumococcal conjugate vaccine or PCV13. Then next one is pneumococcal polysaccharide vaccine or PPSV23. What do you mean by PPSV23? This PPSV23, it is a one-dose vaccine that protects against 23 kinds of bacteria. It is not recommended for children. This PPSV23, it is recommended for the adult over 65 years of age who have already been received this PCV13 vaccine. So you should know the difference between PCV13 and PPSV23. The main difference between PCV13 and PPSV23 is PCV13 which mainly protect against 13 kinds of bacteria, whereas in case of PPSV23 which protect against 23 kinds of bacteria. So this is all about the treatment. Now comes to the complication. What all are the complications of pneumonia? If you are not treating pneumonia properly, what would be the complication? So it can causes lung abscess, then respiratory failure can occur, septicemia. What do you mean by septicemia? That is blood infection can occur, then pleural effusion can occur. That means there will be accumulation of fluid in the pleural cavity. Then pleuritis can happen. What do you mean by pleuritis? What do you mean by pleura? Pleura, this is a membrane which covers lungs. What do you mean by pleuritis? Itis means inflammation. Pleuritis is nothing but infection. There will be chances of infection or inflammation in the pleural cavity. That is called as pleuritis. Then bacteremia can be occurs. That is the presence of bacteria in the blood. That is called as bacteremia. So these all are the complications of pneumonia. That is, first one is lung abscess. Then second one, there are chances of respiratory failure. Septicemia, that is infection in the blood. Then pleural effusion, that is nothing but accumulation of pleural fluid in the pleural cavity. Then pleuritis, that is inflammation of pleura. Then bacteremia also can be seen in these patients. Then next one, the most important topic, that is how do we prevent and control the disease. First one, practice good respiratory hygiene measures. How do we practice good respiratory hygiene measures? We can wash our hands regularly or use an alcohol based hand sanitizer. Second point, you should not do smoking. Then third one, keep immune system strong. How do we keep our immune system strong? You can get enough sleep, you can exercise regularly, and you can eat a good healthy food. Then drink plenty of water to liquefy and mobilize secretions. Take a good supplement such as vitamin C, zinc, which helps to boost your immune system. Then next point, avoid exposure to the people who are ill or whenever possible. Then consult a doctor when you have a high fever, experiencing breathing difficulty, or having a chest pain. So all these conditions you have to seek medical care. Then limit the infection spread by staying at home. Cover mouth and nose when you are coughing and sneezing. Wear mask if you are in public. Washing your hands frequently. Complete antibiotic course if prescribed to prevent the resistance. If the doctor is prescribed with the antibiotic therapy, you have to complete the courses, or else there will be chances of occurrence of resistance. Coming to the summary, we have already seen what do you mean by pneumonia. Pneumonia, it is a respiratory infection that is characterized by inflammation of air sacs in the lungs that is commonly caused by viruses, bacteria and fungi. We have already seen the anatomical classification of pneumonia. Anatomically, it has been classified mainly into three types, that is bronchopneumonia, lobar pneumonia, interstitial pneumonia. Then again we have seen different types of pneumonia. In different types of pneumonia, we have already discussed like different types, like what are the different types of pneumonia. That is bacterial pneumonia is there, viral pneumonias are there, then atypical pneumonia, community acquired pneumonia, hospital acquired pneumonia, ventilator associated pneumonia, aspiration pneumonia. These all are the different types of pneumonia. Then pneumonia can be classified into different types according to the causative agents. We have already seen bacterial pneumonias are there, Viral pneumonias are there. Atypical organisms, like a atypical organism that can also causes pneumonia. This type of pneumonia is called as atypical pneumonia. This atypical pneumonia, it is also called as walking pneumonia. Then treatment for pneumonia, that is depend upon underlying cause of diseases. Then supportive care such as oxygen therapy and taking rest is essential to alleviate the symptoms and promote recovery. Preventing pneumonia, that involves both vaccination and lifestyle measures. Timely identification of cases and isolation of affected individuals and prompt treatment are essential components for the prevention and control of diseases. So this is all about pneumonia. So these all are the references. Thank you.